Hello there, I'm Abdal, an emergency medicine specialist, here to share a glimpse of the reality of our day-to-day life. In the pulsing heart of the hospital, the emergency room, we encounter an array of medical mysteries that keep us on our toes. As ER doctors, we are the frontline warriors, equipped with a blend of knowledge, intuition, and grit. Together with a dedicated team of nurses, radiologists, and specialists, we navigate through the unpredictable tides of healthcare. Now let's dive into the hustle and bustle of the ER. The day starts with a crucial process, the morning handover. This isn't just a simple changing of the guard. It's an intricate dance of information exchange, where the night shift team passes on the baton of knowledge to us, the day shift. We review patient records, absorbing the stories written in clinical language, each detail vital to continuing the narrative of care. Our colleagues from the night shift share their insights, experiences, and the actions they've taken. We listen, ask questions, and together, we ensure that every patient's journey towards health remains uninterrupted. This handover is also a strategic session, where we plan our day around our patients' needs. We coordinate with specialists, organize procedures, and ensure every resource is ready for the day ahead. And just like that, the baton is passed, the torch is lit. With the handover complete, we're ready to face whatever the day brings. Our first patient of the day presents with abdominal pain, a common complaint in the ER. Steady yet full of mystery, abdominal pain can be a symptom of a wide range of conditions, from the benign to the life-threatening. Let's delve into the process of diagnosing and managing this enigma. We begin with history-taking, a crucial step that allows us to gather valuable information. We ask questions about the nature of the pain, its location, severity, onset, and any associated symptoms. The answers provide clues that help us narrow down our differential diagnosis. Next, we conduct a vitals check. Is the patient's heart rate elevated? Is their blood pressure low? These could indicate that the patient is in shock, perhaps due to internal bleeding. On the other hand, normal vitals might point us towards a less urgent but still important condition like gastritis or pancreatitis. Our next tool in the diagnostic arsenal is the point-of-care ultrasound, an invaluable resource in the ER. This non-invasive procedure allows us to visualize the patient's internal organs in real time, right at the bedside. We can look for signs of gallstones, appendicitis, aortic aneurysms, and much more. But we're not alone in this journey. Collaboration is key in medicine, and never more so than in the ER. We work closely with radiologists, who provide expert interpretation of imaging studies, and surgeons, who are ready to step in if surgical intervention is needed. And while we're busy diagnosing and treating, we're also managing the patient's pain and anxiety. We administer appropriate medications and ensure the patient is comfortable. This is all part of our holistic approach to patient care in the ER. So, from the initial complaint of abdominal pain, we've embarked on a journey of discovery, navigating a sea of possibilities to arrive at a diagnosis. And through it all, the patient remains at the heart of our mission. Effective teamwork makes for a successful diagnosis and treatment plan. And that's just one part of a day in the life of an ER doctor. Stay with us as we continue our ER chronicles. Next, we have a patient experiencing palpitations. The heart is racing, thumping, and skipping beats. It's a scary sensation for anyone, and one that brings many people to the emergency room. Our patient today is a middle-aged woman who describes her heart as fluttering in her chest. She's anxious, understandably so, but part of our job in the ER is to reassure and comfort while we investigate. So let's start with careful observation. We're looking for signs of distress, noting her breathing, her color, her level of consciousness. Palpitations can be caused by many things: stress, caffeine, alcohol, medication, or they can be a symptom of conditions like hyperthyroidism or arrhythmia. In this case, we're considering paroxysmal supraventricular tachycardia, or PSVT, a condition where the heart can beat extraordinarily fast. While PSVT isn't typically life-threatening, it can be disconcerting, and it's important to get a handle on it. We decide on an early cardiology follow-up. The cardiologist may recommend treatments ranging from Valsalva maneuvers, techniques to slow the heart rate, to medication, or in some cases, a procedure to correct the rhythm. But let's not get ahead of ourselves. For now, in the ER, we focus on the immediate. We're here to stabilize, to comfort, to begin the process of understanding what's happening. We're a bridge between the patient's experience of their symptoms and the specialists who will dive deeper into diagnosis and treatment. In the ER, we create a reassuring environment. We don't dismiss any concerns, we listen and explain. We navigate the fear and the unknown with our patients, providing a calming presence in the midst of their health scare. We're that first line of defense, the first point of contact, and sometimes that makes all the difference. So, let's circle back to our patient. She's more relaxed now, her heart rate has normalized, and she has a follow-up appointment with a cardiologist. We've done our part. Now, it's up to the specialists. In the ER, every second counts and quick decision-making is key. But so is compassion, patience, and the ability to reassure. Remember, we're not just treating symptoms or diseases, we're treating people. And that's what makes this job so incredibly rewarding. Our next patient is suffering from a severe headache. Now, when we hear severe headache, the possibilities can seem endless. It could be anything from a simple tension headache to a migraine or even something more serious like a brain aneurysm. It's our job to figure out what's going on and how to help the patient. In this case, we suspect a migraine. Migraines aren't just any headache, they can be debilitating, causing intense throbbing pain that can last for hours or even days. They can be accompanied by nausea, vomiting, and extreme sensitivity to light and sound. As ER doctors, our first line of action is to alleviate the patient's discomfort. We administer medication tailored to the patient's needs and medical history. This could include a combination of triptans, which are specific migraine medications, along with anti-nausea drugs and sometimes even opioids if the pain is severe enough. But we don't stop at just treating the symptoms. We need to monitor the patient's progress closely. This means keeping a sharp eye on their vital signs and pain levels. We also need to rule out more serious conditions, like a stroke or aneurysm, especially if the patient's headache is sudden and unlike any they've experienced before. Ultimately, managing severe headaches like migraines isn't just about immediate relief, it's about long-term management. This is where the neurologist comes in. We collaborate closely with specialists to develop a comprehensive treatment plan for the patient. This plan may include preventive medications and lifestyle adjustments, along with strategies to cope with potential triggers. So, you see, ER work isn't just about dealing with the immediate crisis. It's about setting our patients on the path to recovery and helping them manage their health in the long run. And that's exactly what we strive to do each day with each patient we see. Treatment is a combination of immediate relief and long-term management. A car accident victim comes in, raising the intensity in the ER. The moment we receive the alert, adrenaline courses through our veins, but we remain calm and focused despite the chaos. Our training kicks in, and we spring into action, ready to do whatever it takes to save a life. The first step is a quick response. Within a blink of an eye, we're at the patient's side, assessing the situation. We gather as much information as we can from emergency medical services and any bystanders who might have witnessed the accident. This information is crucial, as it helps us understand the severity of the patient's injuries and what we're dealing with. Next, we perform an EFAST examination. This stands for Extended Focused Assessment with Sonography for Trauma. It's a rapid bedside ultrasound used to identify any free fluid, which might suggest internal bleeding. The beauty of the EFAST examination is that it's non-invasive, quick, and can be performed right in the ER, providing us with instant results to guide our next steps. While all this is happening, we're also ordering necessary investigations. These might include blood tests, x-rays, and CT scans, depending on the patient's injuries. It's all about getting a complete picture of what's going on inside the patient's body, so we can make the best possible decisions about their care. During these critical moments, we're also considering insurance coverage. It's a reality of healthcare that these considerations must be made, but our primary concern is always the patient's well-being. We work closely with social workers and case managers to ensure all potential costs are covered and that the patient can focus on their recovery. Finally, our goal is to stabilize the patient. This might involve surgery, or it could mean transferring them to an intensive care unit for close monitoring. Each case is unique, and we adapt our approach accordingly. In emergencies, we work fast, think on our feet, and do our best to stabilize the patient. That's the reality of a day in the life of an ER doctor, where every second counts and every decision matters. As the day winds down, we reflect on the varied cases we've seen. From abdominal pain to palpitations, severe headaches to car accidents, each day in the ER presents unique challenges. It's a roller coaster ride, filled with highs and lows that keeps us on our toes. But what makes it all worthwhile is the dedicated ER team working tirelessly, ensuring every patient gets the best care possible. Thank you for joining me today. Don't forget to subscribe for more insights into the life of an ER doctor.